I smile.
We are going live. 1, 2, 3.
Welcome, everybody. Thank you for joining us today. Naturopathic Nurse Nikki here, and I'm here with Craig Stelflug to my right and Dr. Nishu to my left, naturopathic doctor, owner of MedRoyal here in Chandler, Arizona. So we wanted to first come to you and just say thank you for being here. We are lecturing today on thyroid and autoimmune issues. We have a lot of information to share, so we're going to get started pretty quickly. But I wanted to first give honor to the gentlemen that are sitting next to me and just let you know that we are here doing this for free because we genuinely care. We are naturopathic minded, we care about you, and we want God to bless you, and we want this lecture to bless you. So without further ado, I'm going to say about Craig that he is a world-renowned author. If you haven't seen his books, Fixing the Brain Book 1, Restoring Order to the Brain Disorder, and Fixing the Brain Book 2, Brain Structure versus Function, they are on Amazon, and you can get your copy today. In fact, I actually am reviewing it on the back cover, so I'm really excited about that. Of course, I read both books, and they are both phenomenal. I love both of them. They're individual in their own ways, but book number 2 is my favorite, near and dear to my heart. Also talks about thyroid, so get your copies today. Craig is also a cancer nutritionist, and he's also a neurospecialist, and I won't keep going on and on because we'll be here all day. He's everything. And Dr. Nishu is tremendously amazing. He's an upcoming doctor here in Chandler, Arizona. Like I mentioned, he can do anything from thyroid testing to pediatric urgent care to autoimmune issues. So he has a plethora of availability here at his clinic. If you want to check out, is it medroyal.com?
medroyalaz.com.
medroyalaz.com. And Craig can be reached at realhealthtalk.com. And then I am on Naturopathic Nurse Nikki on Facebook is where you can reach me. So without further ado, Craig, I'll hand it over.
I'm missing my notes. Did you get both my notes?
Oh,
Yep, right here.
No.
There we go.
All right. Well, you do. You do.
Yep.
You got it. See how you are.
Right.
Well, I'm here. I've been telling people that tomorrow I will be with Dr. Hu. And they go, really? Oh, no, not that Dr. Hu. This one's just a little different. Yeah, could you turn this laptop just a little?
There you go.
Back just a little more. There we go. We're live. So you're going to get some of this. Dogs barking, children running through, whatever it takes.
And live guests in person as well. Thank you for
Yes,
being here.
We have the peanut gallery back there. So they start throwing things, you'll know where they're coming from. So we're talking about the thyroid. You want me to start with this?
Yeah, Viva la Thyroid.
Viva la Thyroid. These notes will be posted on YouTube. This is on YouTube Live. If you're having trouble hearing us on this one, find my name on YouTube and you can join us live there. And the archives will be up just as soon as we're done.
Perfect.
And we've actually got a feed with naturopathic nurse Nikki and Dr. Hu also. So any way you can get there, get there. The thyroid. Wow. I love the thyroid. Without the thyroid, we'd be toast. No time at all.
Right.
No, actually, we'd be ice cubes.
Yeah, literally.
And a little too much thyroid, and then we're toast.
Mm-hmm.
Oh, boy. So the thyroid, where is it? It's located right here. It's where the Adam's apple forms. And it's necessary for all hormones. All hormones. Okay? If you don't have good thyroid, you won't have good sex hormones. You won't have good digestive hormones. You won't have anything working. So this one kind of sets the pace. So if your thyroid's slow, then all your other hormones will be slow. And then you'll be looking at all these symptoms, trying to treat your digestive tract symptoms when it was a low thyroid. You're going to be trying to treat your cancer, and it was low thyroid. And without fixing the thyroid, everything stays broken.
Right.
So it maintains your body temperature, right? 98.6, correct?
Mm-hmm.
All right, we're going to go into that a little further in a minute. Enzymes function best in your body at 98.6. So if it's too low, they're too slow. That makes sense?
Your
So
enzyme.
picture them sitting there shivering. They just can't get it going. So you need good body temperature required for brain and sexual development. If a child does not have enough thyroid, then you have the worst case. You have mental retardation and anywhere in between from ADHD to, so we're trying to treat the ADHD with medications. They got low thyroid and their brain is slow for development. Well, let's get with it. Let's check the thyroid. Easy to test. I'll show you how in a little bit. Fires the immune system. If you have autoimmune disease, if you have a weak immune system, guess what? Low thyroid. If you have allergies, the very first allergy barrier in your body is hydration. Then the thyroid. If you have a low thyroid, you're going to have more allergies. So get the thyroid up and see what happens to the allergies. Or you can take the drugs.
No thanks.
Thyroid produces T4, which is your storage form. T3 is your active form. About 93% of when they take your blood test and they look at your panel, about 93% of those are T4. So it's like the grocery truck, right? T3 is what's on the shelf in the supermarket, right? So the medical system does a blood draw, sends it to the lab, and they say, you got lots of T4. You're healthy.
You're fine.
You're fine. I know you got all the symptoms, but they're just symptoms. You can't treat symptoms. So, wait a minute. So that blood test is like taking off with a helicopter, flying over Chandler. We got Fry's right down the street here, big grocery store chain. And you're flying over here and you say, look at all the food trucks. Wow, there's a lot of food in Chandler. And the people in supermarkets are going like there's no food on the shelves. The T4 is running through the blood. T3 is working in the cell, right? So if it's not working in the cell, temperature's low, susceptible to all kinds of things, allergies, autoimmune disease, cancer, you name your problem, let's check for thyroid. Okay, first, let's see, T1. Believe it or not, there's T3, T4. There's also T1 and T2, right? Now the T stands for what? What does T stand for? Tyrosine.
Yep.
It's an amino acid that attaches to iodine. So your T1 is tyrosine and one iodine, or one iodide. T2 is one tyrosine. One tyrosine, two iodines. T3 is 3. T4 is 4 iodide and 1 tyrosine. So it works with tyrosine. T1 is for neurological energy. So if you've got a neurological problem, dementia disorders in particular, I have never seen a dementia disorder with a normal thyroid. And I've been doing this for 2.5 decades. Right? If you have dementia disorder, you're probably low on T1. T2 is your immune system. That's the one that fires your immune system. So if you've got autoimmune problems, you're probably low on T2. But here's the other problem. You go to the doctor and he says, well, you're low thyroid. We'll give you that chemical version. What's that called? The
levothyroxine.
Levothyroxine. Right, and it is great for tricking your body to make more T4. Doesn't help you make your T1 and your T2. But if you're taking the natural thyroid, the desiccated thyroid, the armor, what's that other one, NP or something?
NP, yeah.
Yeah, NP.
And
there's there's a few of them. Those have the whole thyroid and everything it takes to make the thyroid. Because in order to put tyrosine and iodide together, you need selenium, you need zinc, you need lithium. Lithium makes you happy, right? The drug form is just stupid to make you happy. But lithium orotate is the salt version. You get it on Amazon. And people with mood disorders and low thyroid function and low T1 probably need some lithium. Or
Can we give that to our spouses? Just
Yes,
kidding.
yeah. Absolutely. Just sneak it into their morning latte.
Right.
So it's simple and yet it's complex.
Right. Yeah.
Our problems are generally really simple, even though they're complex.
Mm-hmm.
And what I found through the last 2.5 decades is generally there's one or two keys to your health, to unlocking your health, to unlocking the causes of your problems. And if you're throwing 20 things at it and it's not working, you're just guessing.
Right.
Right. And that's where you get with Dr. Hu, Naturopathic, Nurse Nikki, and you get the tests. You find out they're going to guide you through this. You find an expert, somebody who's smart. And you
Thank
hook
you for
up
the
with them. Yeah,
compliment.
there you go. Yes, question.
So my question is, the test that an allopathic doctor would do, is that different from,
Absolutely.
Absolutely.
as far as testing, not just T4?
Right, exactly.
Right. Yeah, one of the things they're looking for is thyroid stimulating hormone, TSH.
Mhm.
So your pituitary gland kind of lives instead of your brain, it's separate from your brain. But it tells them, it's like the orchestra leader. It's going like, thyroid, sex hormones, things like that. And by the way, your body will give up your sex hormones to keep your heart pumping.
Mm-hmm.
Okay.
If
So-
I could just add a couple points. So a lot of times when you go to a doctor, you say, hey, I want my thyroid to be tested. What do they run? TSH, T4, T3 if you're lucky. What they should also add is your free T3, free T4, reverse T3,
Yes.
which is a completely inactive thyroid hormone. If you're converting all your T4s into reverse T3, you are not getting the benefit. And T3 uptake, how well your body is absorbing the T3. Antibodies. If you have an autoimmune thyroid condition, the treatment should be very different from just a regular thyroid condition. One is a condition of the thyroid gland, one is a condition of the immune system. The treatment is very different. So getting all the data, the right data, is the first step to get the proper treatment.
Bam.
Yeah.
There it
Yes,
is.
Absolutely.
Right. Thank you. That was great.
Thank you.
Mhm.
But when they're testing for TSH, and the TSH goes from 0.5 to 5.5. That's like 0 to 55 in less than a second.
Right.
Ridiculous.
Mhm.
So if you've got a 5.5 of TSH, it means your pituitary is going like, give me thyroid. You are desperate. You're going to die. You are not thriving. If you've got a 0.5, your body's going like, we don't need any thyroid. We're so cool. We're doing so good. And your pituitary is going like, okay, we don't need any thyroid, so there's no TSH. Right? 0.5 to 5.5, people. Wow, you want to be close to 0.5. Don't think the bigger number's better. In this case,
Exactly.
the small. If you're 0.5, you're thriving. And a lady freaked out because she was 0.4. And I'm below, and I'm like, wow.
You
This is
should
so
be
cool.
thankful.
Wow, this is great. All right, let's talk about Broda Barnes. Did you study Broda Barnes?
No, that I
You didn't?
No.
Wow, anybody wants to look up Broda Barnes and look up the basal temperature test. And it's versus basal metabolism. And she took people with low basal temperatures, gave them thyroid, and their temperatures came up. Their metabolisms came up. And I'll put a link on this later, but here's a basal temperature chart. So in the morning before you get out of bed, you yawn, don't stretch, get your thermometer, put it under your arm, and go back to sleep for 10 minutes.
Check your basal.
Basal temperature, at rest, complete rest. And then you pull up the thermometer, and then you write down here what your temperature is. This is the only thyroid test I trust, other than an oxygen metabolism test. I do not trust the blood test unless we're doing
It's
the more
panel.
specific.
Yeah.
But this is something you can do at home. Yes.
Is that with an electronic one that tells you what's the
Those
best
are
type?
kind of hard to depend on in my world. If you have a good ovulation thermometer, those are great. If you have one of the old-fashioned mercury ones, don't throw it away. And those things are great. Those are the most accurate. So, what's the temperature supposed to be? Body temperature, 98.6. You should be 0.8 of a degree below, 0.8 tenths under your arm. So here we've got on this chart 98.6, and you start plotting it. 97.8 is where you should be. That's the middle line. And then 97.0 is the bottom line. And you're going to look for this over a few weeks. If you're ovulating, you're a woman, you're ovulating, it's going to come up. And that's how you do your ovulation thermometer test. When you're hot for 3 days, you're hot for 3 days. And that's a good time to get pregnant. So
or
you get
not
that,
get pregnant.
or not get pregnant. Right. So as you're plotting this out, you're going to see where you're at. If you're below 97.8, you're low thyroid. No doubt about it. Right? You need to work on the thyroid. If you're below 97.0, and I've seen them, 96.4, you know, I got cancer and I can't hardly move. I'm cold all the time. I'm sick. I can't remember things. They're low thyroid, and they're like flatline. But here's the other thing. If your thyroid's 96.4, 97.3, 96.8, 97.1, if it's bouncing all over the place and it's low, you're low thyroid, but your adrenals are bouncing. Right? So this is a two-edged sword test. Here's your thyroid, right? Balancing your body. Here's your adrenals, right? And they're playing this little balance game, and your thyroid, it's getting weak. It's getting weak. Your adrenals are getting up, picking up. Your adrenals are stressed. You got more stress. Boom. They're both broken. Now you're running on cortisol. You get the cortisol belly. You can't metabolize your fats, right? Your triglycerides go up. Your sleep is all broken. You eat big meals at night, and it's just all wacky doodle. Did you know cortisol opposes melatonin?
Right, melatonin.
Right, so cortisol pushes melatonin down.
Right.
So if your thyroid and your adrenals are broken, and running on cortisol, you're in trouble.
Right. Yeah.
Got this phone ringing in the background, dogs barking.
It's okay.
So if you're bouncing, even if you're normal thyroid, normal temperature, but you're bouncing, it's adrenals.
Mm-hmm.
Yeah, exactly.
Yep. Adrenal fatigue.
And there are tests for adrenals, and there's also this one you can do at home.
Mm-hmm.
I love this because people can do this at home before they come see me. I'd say, okay, I want 2 weeks of a basal temperature. And then I'd already know.
Absolutely.
Right. So, Dr. Nishu, what would you do to test for adrenals?
So adrenals, there are many tests. You know, there's blood, urine, saliva. I prefer salivary cortisol test ×4, so you can get the plot.
Right.
Yeah.
Otherwise, you just get a snapshot,
Yeah.
and it's supposed to start out high and come down
Right.
through the day. Yeah, you need at least 4 or 5.
Exactly.
Here's another test. Take your blood pressure laying down after laying still for 5 minutes.
Mm-hmm.
Stand up, take your blood pressure again. It'll go up or down. It should go up 10 points.
Yeah.
If you stood up and you fell over because you passed out, you dropped. Your adrenals are shot. You're in trouble.
Mm-hmm.
So if you're rising up from the couch and you go like, whoa, I'm woozy, you could have low adrenals. And that's a good sign for it.
It is.
And that's also a good test if you have your blood pressure machine at home. Test your kids. You know, it should go up 10 points.
Mm-hmm.
Right? The heart rate should go up 10 points. Your high side, your low side, it should all come up 10 points.
Yep.
If it stays the same, you're low. If it drops, you're in trouble.
Right. Orthostatic blood pressure.
I love home tests. And there's a spit test.
Right, but you know, if you don't have a doctor who can order that for you, it's very useful to do that at home.
Right.
Absolutely, or do it at home. Now you've got, okay, I think Craig said this means low. Now go see Dr. Hu. Now get hold of naturopathic nurse Nikki. say, hey, I did the test, shows to be low, and then you guys would say, oh, let's do a spit test. Let's see what the cortisol is doing. Let's look at your free reverse T3. Let's look at,
Look at everything. Yeah.
right. But these basic tests can give you a clue. They can get you started. And if you have a loved one with a dementia disorder, you better start here. Start here.
Right.
And give them what they need.
Right.
They need thyroid.
Mhm.
Oh my
We
gosh.
do.
Ooh, symptoms. Oh boy, I'm just gonna rattle off some of these because these symptoms are so wide. Symptoms of low thyroid. Well, I'll let you read them, or just read a few.
Absolutely.
Just pick a few of them.
I'm always up for that. Okay, appetite disruption, either heightened or diminished. Autoimmune conditions, including allergies, lupus, and rheumatoid arthritis.
Wait, rheumatoid arthritis. Did you hear that, Anna Sarah in Montana? Called you out by name, didn't I?
Oh, man. Also Hashimoto's, which is one of your
Hashimoto's
specialties.
That is.
Mhm. Blood sugar disorders such as diabetes type 1 or 2, hypoglycemia or a combination of the two, cancers of all kinds, cardiovascular abnormalities including high cholesterol, poor circulation, heart palpitations, hypertension, which is just high blood pressure, and hypotension, which is just low blood pressure. Dental problems, including chronic gum infections, receding gums, and TMJ, or temporomandibular joint dysfunction, which is clenching of the teeth. Some people I know do that at night, leading to chronic inflammation and pain in the temporomandibular joint. Fatigue and lethargy, gastrointestinal disorders, including irritable bowel syndrome, or things such as Crohn's, ulcerative colitis.
Right. Remember, if the enzymes aren't working.
Right, digestive enzymes. And impaired digestion leading to constipation and nutritional disorders. Heart conditions, including coronary artery disease from accelerated atherosclerosis, which is just hardening of the arteries. Arrhythmia, which is irregular heartbeat. Abnormal blood pressure, either too high or too low.
If you got a heartbeat that's not normal, why not just get a pacemaker?
Oh gosh, why go so invasive? No, thank you. Oh,
But your
goodness.
thyroid test normal,
Right.
so you need a pacemaker,
No,
don't you?
no. Diminished cardiac output, weakness of the heart muscle, and congestive heart failure. A lot of heart issues.
A lot of heart attacks start with low thyroid. I think in my world, weakness in the cardiovascular system starts with thyroid.
Wow.
So, and then it ends up with inflammation from other different causes too. But
Right.
go ahead.
Like
I digress.
cardiomyopathy and whatnot. Okay. Hoarseness of the voice, difficulty in swallowing, swollen, enlarged tongue, and sleep apnea. Immune response malfunction, leading to increased infections, including candida, which is basically yeast, in all parts of the body. Mental and emotional problems, including difficulty in cognition and anxiety, depression, memory loss, manic depression, psychosis, and schizophrenia. So many of my patients. Oh my goodness.
Xanax in there.
Oh
you
gosh,
rather
no.
take Xanax
I would never. No. Our goal is to get our clients off of those medications if possible. And also, when you prescribe those medications as a medical doctor, you're masking the problem instead of fixing the underlying issue. So they throw a drug on top, which causes other issues, and then they prescribe a drug for that issue, and then it just keeps going on. I had a patient who was on 22 different medications. Yeah.
I've seen 15.
Okay.
I don't think I've seen 22.
Never seen 22? Okay.
Wow.
Hey, I got you beat. For once, that never happens, just for the record. All right, so metabolism malfunctions leading to weight gain usually, or weight loss occasionally. Muscular disturbances, including ataxia, which is lack of coordination, carpal tunnel syndrome,
Really?
fibromyalgia, a huge one nowadays,
Right.
and weakness. Do you want to speak to that?
fibromyalgia.
Mm-hmm.
Who knew it could be your thyroid?
Right.
Right. Now, I would say this about fibromyalgia, just to pull it out of the segment and say this, that probably 90% or more, probably more, 90% of the fibromyalgia patients I've seen are allergic to gluten,
Right.
and it causes inflammation. And part of that gluten intolerance could be from low thyroid.
Right, exactly. You mentioned, we always talk about going gluten-free, and even you,
Mhm.
right? Gluten-free,
Absolutely.
sugar-free,
Dairy-free.
dairy-free, right? Those three things, and we've said that from the beginning of time. That's
Yeah.
not anything new.
Even
But-
before Facebook Live.
Even before Facebook Live, we've always been teaching that. And so, yeah, that's a big one. Also, what I want to mention also is what we talked about earlier with outside of the cameras, the Epstein-Barr virus.
Mhm.
So Epstein-Barr virus can actually cause Hashimoto's and issues with thyroid. So Epstein-Barr virus is very common. Out of 340 billion people on the earth, about 240 of them actually have the virus and they don't even know it.
That's a high percentage.
Very high percentage. And so I would encourage to see Dr. Nishu and get an Epstein-Barr titer just to see if you do have it. It usually shows up on the test. Sometimes it doesn't show up on the test. But Epstein-Barr, in its fourth stage, there are 4 stages of Epstein-Barr virus. In its fourth stage, it attacks the thyroid. And any job of any virus is to take over its host. Well, if you have that virus, you are the host, literally. So that virus invades one by one each of your organs. It takes up shop in one specific organ, usually the liver or the spleen, because that's where it can eat up a lot of toxins such as mercury, because your liver is the filtration system of your body. And so Epstein-Barr virus takes up shop there because it can eat.
Mhm.
And a lot of times, too, that's where some of your food intolerances are coming from. You know, before you weren't allergic or had issues with cheese, and now all of a sudden, 10 years later, you're having problems. And that's because the Epstein-Barr virus is feeding off of that food that you're eating, and then it becomes their food. And then you become intolerant to that certain food. And so I would encourage, you know, if you are having trouble with your thyroid as well, that's another option, is getting that titer done just to see if you have that virus, and that could be potentially causing your Hashimoto's or causing your thyroid issues.
Well,
So,
Epstein-Barr loves low oxygen.
yes,
So if you're low oxygen, you're low thyroid.
right,
And it's kind of a self-promoting thing where the lower it can lower your thyroid, the lower the oxygen levels, the better the Epstein-Barr virus can function, and the quicker it takes you down. It just accelerates.
right,
It's a snowball rolling downhill.
And
right,
as you said, Epstein-Barr and oxygen. So people, you know, with Epstein-Barr virus issues, I tell them, you know, before you make a sudden change in your diet, you know, a lot of people are doing ketogenic diet, which is very high fat.
Mm-hmm.
And high fat diet does decrease the oxygenation in your blood. So
Right.
although a lot of people, you know, might benefit from a diet like that, you know, make sure you're considering other factors as well.
right,
Yeah.
exactly,
And that's
yeah.
where you find an expert.
Mm-hmm.
Yeah.
Yeah,
We
yeah.
wait for the next lecture where we talk about that.
Exactly, yeah. And I have some notes that I'll post after. If you are tested positive for the Epstein-Barr virus, there's a protocol that you can do to help yourself. So I will post that later. It's too much to go into, but lots of food changes and whatnot. So moving on. Pain in the joints and muscles, including arthritis and fibromyalgia, we said. Perspiration reduction. Reproductive disorders, including birth defects, cysts in the breasts and ovaries, endometriosis, infertility. I have a lot of patients dealing with that, and especially
More and
PCOS, more and more.
Yeah.
And menstrual disturbances. Respiratory conditions, including asthma, emphysema, pneumonia, and chronic sinus infections. Asthma. Wow. Skin disorders, including acne, alopecia, which is just hair loss, boils, dryness, eczema, hives and psoriasis, sleepiness and sleep apnea, slowed movement and speech, structural weaknesses, deformities, and impaired ability to repair damaged tissues, manifesting in brittle nails, brittle or scant hair, including baldness, degenerating bones, osteoporosis, malformed bones, scoliosis.
Yeah, let's touch on scoliosis. If you have a child developing scoliosis, they're low thyroid. Quite often they're low thyroid, and that is a major cause of scoliosis. So you're looking for the cause, you're looking for the problems. Well, this is the cause. This is a huge cause of scoliosis. And then too, as we get older and the spine starts to curve and stuff, right here, low thyroid, that's a key factor.
Amazing. Somebody out there needs to hear this. Yeah. So any of these symptoms that we've mentioned, anybody have any of these or experienced these in the past? Yeah. And thinning and loss of eyebrows, notably the outer third of the eyebrow. Temperature regulation malfunction, intolerance to heat, and excessive coldness, particularly in your extremities, which are your hands and feet. Urinary tract problems, such as urinary infections and especially kidney failure from shrunken, scarred kidneys. Wow.
And that's just some of the symptoms, because this is a spectrum. Your body has a whole spectrum of disorders from health to, whoa, disease showed up. Where are you in that spectrum? Well, I'm doing pretty good. Feel pretty good,
Yeah.
Get the smelly thumbs going, yeah, I'm doing okay. Here's optimal health. Here's where disease showed up. What if you're right here and you think you're okay?
Right.
Now is the time to seek your health. The best time to seek your health is while you still have it. Because once you've got the cancer, once you've got the early onset dementia, once you've got, the ADHD, the autism,
Right. And
it's harder to fight back.
Thyroid actually in ancient Greek means shield. So maybe it's a location or the shape of the thyroid gland, but really it is a shield for our house. And when we lose that shield, we get a lot of different issues.
Yeah.
That's
a good
amazing.
one. I hadn't even heard that one.
Right?
Yeah, I just
like
read it somewhere a couple months ago.
Mhm.
I like it. So remember, blood test does not test how the thyroid is working inside the cells. Right? So we want the basal temperature test. Let's see, thyroid support. Oh, let's talk about what to do for
Thyroid
it.
support.
Yes.
Right?
Good
Thyroid
stuff.
support. All right, so
What do you do?
RDA, what does that stand for? US RDA.
Recommended.
Recommended daily
allowance. Right?
allowance. In my world, it's ridiculously deficient amounts.
That's a good one still.
Okay, so yeah, I'll trade you for the
All
shield.
right.
There
Sounds
you go.
Iodine, the RDA is 150 micrograms.
Wow.
Now, consider this, that's supposedly a perfectly healthy person with a perfectly healthy diet. That's all they're going to need to maintain perfect health. Okay? That's not going to work.
Mhm.
Kelp has 120 micrograms. In my world, iodine, you need 7.5 milligrams. 7.5, did you hear it?
Milligrams.
So how much bigger is a milligram from a microgram?
Very.
1,000
Yeah.
increments of 1,000.
Mhm.
And if you're behind, you're going to need twice that.
Right.
You're literally going to need 1,000 times more than the ridiculously deficient amount because you're behind on your health. You can't catch up on 150 micrograms. You cannot do it. It won't happen.
Is that the iodized form?
Iodide, yes, and iodine, right? They're two different forms, but iodide is probably one of the easiest ones. You've got some somewhere. Oh, I was coveting you.
Yep, so this is Terry Naturally Thyroid Care Plus. Iodine and L-tyrosine supports thyroid and complete metabolic function. So this has iodine 30,000 micrograms, which is 30 milligrams. Selenium, like you talked about earlier, you need selenium as well. And L-tyrosine 400 milligrams.
Go figure that.
Mm-hmm. So that's what's in this. How would you recommend them putting lithium in as well?
Well, the lithium you have to get separate, and it's lithium orotate. Order it online. I think it's 120 milligrams. You only need one a day. That's plenty. But in the orotate form, you're not going to get poisoned.
Right.
Now, if you get 600 milligrams of lithium, the drug form, you can be pretty happy for a while, but you can be pretty poisoned
Right, very much so,
because
yeah.
of the chemical form.
Mhm.
So yeah, Terry Natural Thyroid Plus, and if you're behind, it's gonna take more to get you caught up.
Mhm.
You better keep
Absolutely,
that
yeah.
because
Let me-
I'll take that home
He's
with
going to
me.
take it. So, Dr. Nishu, what would you recommend for your patients coming
Right.
in who need iodine?
So I'm actually going to ask you guys that question. So my understanding is that once a patient is tested positive for antibodies, so let's say they had Hashimoto's,
Mhm.
it is actually controversial to supplement iodine and tyrosine because it could make their thyroid gland more inflamed. What are your thoughts on that?
Okay, so who here is allergic to air? Anybody here allergic to air? Nobody's allergic to iodine. Iodine works in every cell of the body. If you are taking iodine, you are reacting. You cannot metabolize the iodine you have.
Okay.
That's where you would have to find the cause.
Right.
How come you can't use your iodine? What's going on? Oh, needed some orotate, some lithium orotate.
Good
Right.
point.
Good point.
They had mercury amalgam fillings.
In their
They're
mouth.
pretty close to the thyroid. They gobble up selenium.
So those are, just to clarify, because someone had a question the other day about that, they're the fillings that you used to get at the dentist office, right? That were mercury. What color are they? Like silver color, right?
Mhm.
So those are not good, is what you're saying. You
Right.
should have them removed by a doctor who knows how to do it, a
Yes.
dentist who knows how to do it without you breathing it in,
Mhm.
A
right?
biological
Right,
dentist.
Biological dentist.
In the
thank
Phoenix
you.
area, there's Dr. Greg Manning. I think it's Dentistry at Power Ranch,
Mhm.
and he does it the way I want it done.
Right.
And I send him patients because
Yep,
He's
just
good,
ask him to no epi. And he
Oh,
won't
no.
he won't give it to
no
you.
epinephrine.
No epi. But he is phenomenal. I've been to him a couple of times too. And you can have those fillings removed and replaced with the white fillings that are
Right.
not gonna harm you.
But then don't get the coating, the BPA coating,
Right.
because that is a hormone disruptor. We're going to talk about hormone disruptors here in a little bit, but while we're on the mercury thing, where else do we find mercury?
Oh,
Fish.
fish. Yeah.
Fish!
Tuna.
No way, oh man. I
Shark.
love fish. And
Shark
the bigger
is
the
high.
fish, the more mercury
Right.
they're going to have.
Right.
Right, so where else do we find it? Vaccines.
Oh gosh, we knew that answer.
Vaccines,
Oh, he's trying to trick us.
Vaccinations. And did you know that the mercury-free vaccinations still have mercury in them?
Right.
They're just mercury light because they use mercury in the process. They recover the mercury, but some of it's lost in process.
Right.
Same thing with high fructose corn syrup. They use mercury to separate the sugar molecules to make it 10 times sweeter than sugar
Whoa.
Oh,
and cheaper than sugar.
didn't know that.
And it's in everything.
And
It's in everything.
some of
Bingo.
that mercury is lost in process. It's in diapers. I've had mommies bring babies into my clinic they're holding them by the back of the head and the feet, and they're raw. And they said, we've tried the zinc oxide, we've tried the antifungals, we've tried the antibiotics, we've tried the baby butt cream, which is actually pretty good cream. Has a little petroleum in it though. But we tried everything in my babies, and it's a bleeding rash, a raw where I said, go put them in a bentonite bath.
Bentonite.
Bentonite clay because it pulls the mercury out.
Mm-hmm.
Because there's thimerosal. There's a mercury disinfectant in diapers. And where else is it in? It's in Kotex.
Mm-hmm. Yep. Your
I've
tampons,
had
your
patients, especially young ladies, who they start to menstruate and all of a sudden they've got horrible, bad rashes.
Mm-hmm.
And it's the Kotex.
Mm-hmm. Or hormone disruption as well.
Yes, it's a hormone disruptor too.
Mm-hmm.
Yeah, so mercury gobbles up your selenium. Without selenium, no thyroid.
Right.
Right? Mercury collects in your liver. Well, if your gut doesn't get it out, it kind of collects in your liver, but it disperses by osmotic pressure.
Right.
So your liver's saying, I got too much mercury. So the tissues around your gut say, okay, send some here. Then the tissues around your gut are going like, hey, muscle, can you take some of this? Yeah, hey, neurological system, can you take some of this? Hey, skin, can you take some of this? Right, so it distributes to the whole body. And I was telling someone the other day, it's like if you take let's say you take a quarter cup of red food dye, and you've got a gallon glass jug of water, pour the food dye in it. What happens? The whole thing turns kind of pink.
Right.
It distributes by osmotic pressure. Mercury does the same thing in your body.
Physics.
It distributes. So you take a straw and you stick a straw down that gallon, stick your thumb over the straw, and you draw out a straw full of mercury, red food dye, and put it down the sink, and then take a straw full of clean water, put it back in. Right? It helps, right? How many times are you going to have to do that?
A lot.
To exchange that water?
Mm-hmm.
A lot.
Right.
And some people, they're a phenotype that we call non-excretors. So they get a hold of heavy metals and they hold on to it. They don't let go of it. That's you. They are non-excretors. They get those toxins and they say, I can't let go of these. I got to keep these. And then there's some people who can literally, don't do this, don't try this, but drink a beaker of mercury. And their body will get rid of it and they'll say, what'd you do that for? Don't do that again.
Mm-hmm.
But it'll handle it. Some people can handle it. Some people can tread water with a 10-pound weight. Some people can.
Right.
Some people can tread water with a 10-pound weight for 24 hours.
Mm-hmm.
Some people can't. So, you can't say because it's this way for one person, this way for every person.
We're all different.
So the amount of metals you excrete
right.
is up to your phenotype.
Yeah.
It's how did God make you? What's happened to your body? How's your thyroid?
Mm-hmm.
If your thyroid's low, you can't excrete the metals.
Right.
And if you have the metals, you can't build the thyroid.
Right.
It's a trap.
It's a trap.
It's a Chinese finger trap.
Mm-hmm. Yeah.
He was this doctor who I've been getting to know him over the past few days, and he was born in Beijing and then raised in Hungary.
In Hungary, that's right.
It's like, wow, that's so cool.
Yes.
What a story this guy has. It'd be worth the price of admission to come here and just meet him.
Oh,
Yeah,
thank you. You're very
absolutely.
kind.
Absolutely, he's amazing.
Hey, Craig, I'm sorry, really quickly before you move on. You're saying if you get the thyroid up and going, the body will excrete metals, or do
It will help.
you need other assistance?
Yeah, I was just going to touch on that. Yes.
Okay.
I was going to move on just a little bit.
Let's talk about heavy metals. Okay.
Right. Chelation therapy.
There's chelation therapy,
Right.
but here's what happened back in the 90s. I was big in the autism, and people were bringing their kid with autism to me, and it was a big thing with Dan, Defeat Autism Now, to chelate. And we chelate this child, and the parents go like, there's Johnny, he's coming back in 3 or 4 weeks. There goes Johnny, he's coming back. And what you've done, you've started pulling metals out of the neurological system, the central nervous system. Little Johnny starts to function a little better, and the gut goes, oh good, here, take some of this. And it frees up mercury to float around, re-injures the central nervous system. So remember, this is osmotic pressure, right?
Mm-hmm.
What we want to do is we want to take it out of the skin. We want to take it out of the gut. Because now the gut, if you're taking it out of the gut, then the organs say, oh, here, take some of mine. You take it out of the skin. And then the muscle says, oh, here, take some of mine. The neurological system says, let's move it that way. So you get the metals moving in that direction before you do the heavy-duty chelation. Now, I had a kid who was so full of lead poisoning, you have to do something right now. Now. You do it now or the kid's going to die. That's one case. But if you're just toxic in it, let's get them moving out. Let's get them coming through the skin. Take some clay baths.
Right.
Right. Bentonite clay is cheap. You might look on Amazon and say, well, that's not so cheap. But if you go to Walmart, it's cheap.
Yeah, absolutely.
How cheap is it? You get a
Fragrance
20-pound
free.
bag for $4 or $5.
Mm-hmm.
And it's called kitty litter.
Yep.
And you put it in like an old pillowcase, tie a knot in it, throw it in the bath, let the kids play in it for 30 minutes, an hour. It'll get rid of their diaper rash. that's caused by mercury.
Right.
And it'll get rid of it within minutes. Things will be getting better if that caused it.
Right. Because it absorbs those metals.
Yes.
Right. Yeah.
It's double ionic. It's like two magnets on one piece of metal.
Right.
Pulls it out of the skin.
Yeah. Make sure you get fragrance free.
Fragrance free. Yeah. Get just basic, run of the mill. Right. Get the cheap stuff, the really cheap stuff.
Right.
Right. No fragrance, because that would be bad.
Right.
Or you can get different places. You get Amazon's got some good sources.
Right.
But you start chelating it and drink some. Drink some. There's some liquid stuff you get. And I recommend twice a year, drink a quart bottle of it through a week. And then your gut is epithelial cells, right? Epithelial is outside, right? The lungs are 94%, I think 94% epithelial. If you have problems in your lungs, it's epithelial. So you need to treat that. Get the thyroid up, get the vitamin A up. But if you got lung problems and you've got heavy metals, you're going to have to get the metals moving away from the lungs.
Right.
Which takes thyroid and takes chelation.
What about cilantro and chlorella?
Whoa.
Right.
Love those. Now, here's the thing about cilantro. You can get capsules of cilantro at the health food store, on Amazon, or capsules or tablets, usually it's tablets. Take those in the morning and it knocks your heavy metals loose. Right. Sounds good, right? Except now it's circulating.
Right.
Chlorella grabs it. So if you take a bunch of chlorella, it'll grab what's on the surface. If you take cilantro first in the morning, it'll knock it loose. You take chlorella in the afternoon, it'll grab it.
Right.
Carry it out of the body. You drink the chlorella or some of those other green drinks. They're great. They're super duper for grabbing metals, getting them out of the gut. If you get them out of the gut, the organs start to give it to the gut.
Right.
And you get it moving in that direction. And each time you're taking a straw full out of the gallon jug, and it's going to take a while.
Right. And then your liver, you can do the coffee enemas to help that process along.
They're huge.
Right.
And I had a man who was dying of small cell lung cancer. And I told him, I said, okay, you're going to have to, we've got to pull your teeth. They're full of mercury metals. This is a very famous guy. Very famous. And I said, you're going to have to do coffee enemas. And he's, whoa. I'll do everything else. I'll change my diet. I'll take all these vitamins. I'll do this. I'll do that. Two things I'm not doing. These teeth are my persona. These teeth, people recognize me for these teeth. They're my persona. Second thing, nothing's going up my butt. He said that to me. And I said, well, that's great. Here's the information I gave you. You're not going to be my patient. I'm sorry. I can't help you. Because if you're not going to do everything I say, you're not going to get the results that I have coming to my clinic at the time. Right? If you want that 90% remission, you got to do everything I say or you're going to make me look bad.
Right. Yeah. Right.
You're going to die and it's going to make me look bad. And so patients come to you and they say, fix me, and then they don't do what you say to do. It makes you look bad. Well, Dr. Who can't fix me. Well,
it's those lifestyle changes that are the most difficult, especially dietary. Once you're using certain foods for the most of your life, it's hard to cut everything out all at once. But I feel like if you can explain to them why they need to do that, and when they're informed, they're more likely to adhere to your treatment plan.
Right.
Or you'll just have a repeat patient, which is okay for the money. But the healing arts is not about that. Healing arts is find your problem, fix it.
Right.
I don't want you coming back except for to visit.
Right.
Or to bring your nephew. Or to bring your aunt. That's a successful practice. That's healing arts.
Yeah. Or to give us a praise report.
Right.
Yeah. There you go.
Bring me a coffee.
Yeah. Bring me a coffee.
I would dare say we shouldn't pay our doctors till we're cured.
Oh, everyone likes that.
I mean, turn off my phone, right?
What would you think of that paradigm?
I agree with that.
the doctors would be more interested in.
Yeah.
And okay, I'm going to follow up. I'm going to make sure, Christina, that you do everything I say. Because I want my paycheck.
Right.
And I want you healthy.
Right.
But technically, it's not about the money. It
Right.
can't be. If you're in this for the money, you're going to make money. And you're going to hurt a lot of people.
Right.
Right.
Yeah. We always say, and I think you would agree, and I can speak to this, that we don't want to stand before God and say, we didn't help this person, this mom of 5,
Right.
with her cancer, and she died because she didn't have the money to pay us.
Right.
I'll cry on you, almost softy.
Right.
But I just really, we want to help people no matter what. And you're
Well,
right, the money is not for the
And what's
money.
God going to say? He's going to say, what?
Right.
This was about money?
Right.
No, it's about healing arts. It's about inspiration.
Right.
It's about walking with the Holy Spirit. And the Holy Spirit says, this is what's wrong. It leads you.
Right.
That's the position I want.
Amen.
Right. I don't want the one who says, well, let's say we're tested for this and this and this and this and this and this and this. This, are you broke yet? Okay. Let's test for
You broke it.
let's test for this.
Yep.
Phew, oh boy.
Uh-huh.
Rabbit trails, thyroid support.
Right. So back to what can you do to help
can
your
you do?
thyroid?
Tyrosine. There's people that they've got plenty of iodine, they don't have enough tyrosine, an amino acid, right?
Yep.
And you take supplemental tyrosine, all of a sudden their mental clarity comes back.
Mm-hmm.
Their pre-dementia stuff, their part-timers and their some-timers goes away.
Right.
Selenium, 200 micrograms a day.
Mm-hmm.
And if you have mercury metal fillings, you got to get rid of them.
Right.
And if you're scheduled for a flu shot, you got to cancel it.
Yeah.
Because if the people who have had 5 flu shots 5 years in a row are 500% more susceptible to dementia disorders
Right.
than people who do not get flu shots.
Yep. Can I say one thing really quick?
Absolutely.
You talked about vaccines having mercury and whatnot. So I just want to make sure that everyone understands, because I know I've had a lot of clients that their children have already been vaccinated. They didn't know. And then they ask, well, what can I do now to, help them to excrete all those? And what you talked about with the bentonite clay
Absolutely.
is something that you mamas can do for your babies too.
Cilantro chlorella.
Yeah, right. Okay, just wanted to make sure.
Yeah.
So,
Check that thyroid. Take their
Right.
temperature.
What
Now,
about activated charcoal? Do you think that's more like an inferior type of chelation therapy, or
I think it's superior for the gut.
yeah.
for the gut? Okay.
Yeah.
Every naturopathic nurse has activated charcoal on hand.
If you
Yep.
take too much Tylenol, you show up at the ER, what's the first thing you get?
Activated charcoal.
Activated charcoal. It'll save your life,
Right.
and it will save it now.
Yeah.
It absorbs toxins now. You don't take it all day, every day.
Right. And you can't take it with medication, supplements, or with food. It will bind to those things instead.
Right.
Yeah.
Right.
Yeah, if you get food poisoning, activated charcoal.
Right.
Take it and take it out. Carry it in your purse, girls.
Yep.
Carry it in your glove box. Carry it somewhere. It's cheap, but if it's 10:30 at night and you just ate sushi somewhere and you're getting sick,
Yeah.
you're gonna need it.
Yep. It's going
Keep
to
it around.
absorb all those toxins and excrete.
And
Yeah,
don't
there's-
actually eat charcoal, right?
Right.
Yeah.
Don't
Yeah.
munch on a piece of
If your
charcoal.
baby gets into the baby Tylenol, which I don't know why you'd have that,
Right. Don't have that in your house.
but on your way, give them a whole bunch of activated charcoal. I buy a bag of it on Amazon.
Yep.
And I pour a quart jar, about a third full, fill it up with water, and just set it in the cabinet. And if you need some, you shake it up and look, look, look. There it is. Cheap, highly effective.
Mhm.
Everybody, this is poison control.
Right.
Everybody should have this in their home.
Mhm.
And everybody should not have poisons in their home.
Right.
Astragalus. Oh, wait,
Oh,
back
zinc.
up. Zinc, 30 to 50 milligrams. You know, one of the quickest, easiest way to tell if you are zinc deficient? Look at your fingernails.
Oh, mine are
Yours are painted.
painted.
And if you have little white flecks in them, you are zinc deficient.
Right.
Look for those white flecks in your fingernails, your toenails. Everybody's out there looking at them right now.
Mhm.
And just 30 to 50 micrograms a day is all you need.
Or alkaline phosphatase. I have a lot of patients coming to me with their lab where they have a borderline low alkaline phosphatase. I'm like, did your doctor who run the lab tell you why it's low? They're like, oh, they tell me that it's no big deal, but zinc deficiency could be one of the reasons why you have that.
And it will kill you slowly. It will kill you in 30 years. Slowly, miserably, kill you in 30 years.
Right.
Right. So zinc is required for testicular growth, ovarian growth, and developing child development. You know, it's
fertility for men.
Fertility for men. Yeah.
I'm so glad you said that. I was just gonna make a joke about that because we have 5 children and we had been trying for a boy. And Craig comes along after we had our last baby and said, "No more. We keep having girls." And he says, "Oh, just have him take some zinc." And baking soda at night, teaspoon, and you can have a boy. And I thought, oh gosh, I can't do that now. I am so done. But it would have been nice, right?
Right.
So good point.
Yeah. And what do you guys think about the zinc and copper ratio? How if you take more than 30 milligrams of zinc, you should add some copper too. Do you agree with that?
Absolutely, a chelated form.
What if you're high in copper? I'm low in zinc and high in copper. Would you still take the copper with the zinc?
Oh, no.
We just have to monitor your copper zinc levels, once a couple months to make sure the ratio is still right. Yeah.
Right. Yeah, definitely don't need to keep taking copper.
Right.
Now, are you cooking with copper bottom cookware?
No.
Okay, good.
I'm just high in heavy metals. So I got to figure it out.
Yeah. Well, titanium cookware.
Yep.
Because stainless steel, it's good, but metals still leach through the stainless because it's porous.
What about cast iron?
No.
No. That okay. So, kind of another rabbit trail here, but if you have hemorrhoids, you probably have too much iron. And if you take rutin, which is a bioflavonoid, it binds to the metals, the iron in your colon, and a few hours later, you're getting better. Isn't that interesting?
Yeah.
So the problem with the iron, you'll get a little bit of, it'll help your iron levels. If you're low in iron, you've got something else going on. Parasites, low thyroid, fungus, something consuming your iron. But the iron from the skillets is like trying to pass a football through a garden hose. Your body can't use it and it gets stuck. So not a good idea.
Where can we get good pans to use for cooking?
Ta-da!
So we both use Salad Master. We don't sell it, right? But we use it. So, we get nothing out of saying that. But we do have some friends or colleagues that we can refer you to if you're interested in purchasing Salad Master. But Salad Master is all titanium.
The newer
one, yeah. The older ones are stainless. Right, yeah. And so basically, you're not having those metals leach into your food when you're cooking. And I promise you'll notice a difference within about 2 weeks. Yeah.
Yeah, and if you're a cancer patient, there will be heavy metals in the cancer cells. And there will be excess heavy metals in your body. And we can do a provocation test and see what metals come out. And I've done that with patients. Chelate. A few weeks later, they're back up again. Well, they're cooking on crappy cookware.
Yeah, it's getting in their bloodstream.
Right. So titanium is what I recommend. And I'm not trying to put in a plug for Salad Master, but if you have problems with heavy metals, and you might want to consider it. It's an investment.
Yeah.
Go to a Salad Master show and just watch.
Yeah.
Even if you don't buy it.
Right.
They will teach you a lesson in health.
Yep, and there's lots of ways to actually earn free Salad Master. In fact, I've gotten 4 free items.
Yeah.
Right?
I know. Check my luggage before I leave your house.
Right. Yeah.
Oops, did I say that out
Yep,
loud?
you sure did.
Thyroid support.
Okay.
Astragalus, my favorite go-to herb. If you have Epstein-Barr virus, astragalus will help you defeat that. It boosts your immune system. If you're on chemotherapy, for golly's sake, take astragalus
Mhm.
because it will make the chemotherapy work better and it will help defeat some of the side effects.
Right.
I'm not an advocate of chemotherapy, but some patients want to do both.
Right.
And I can't argue with that. I mean, they're making their informed decisions. But I'm saying, get on astragalus.
Mhm.
And if your thyroid's low, get on astragalus because it helps your adrenals.
Right.
This is a traditional Chinese medicine. Mr. I was
Yeah.
born in China.
Right. Yeah.
And
And
it's got 5,000 years of medical records to back it up.
right.
True. I grew up. My family manages a hospital in China. I grew up and in the hospital, and no matter what people are coming in for, it's herbs, acupuncture, yeah. So no medication. And then went to Hungary for 9 years, and then came home to China, and it's medication. Because people westernized. That's right.
Yep.
Yeah, but people now are more sick than ever.
Yeah, I was working on a
That makes my
hospital
heart-
project in Argentina, and governing officials down there said, we can't afford your medical help here. And I said, but this is a UN project. It's going to be free. I said, no, we cannot afford it. It will kill us.
Oh.
And I said,
Right.
well, we're trying to do integrative medicine here. Right. So, but they were already aware. But
Right.
now guess what they got?
Mhm. Yeah. They didn't want your natural stuff because they were making too much money on their medicinal stuff.
Yeah.
And now they have problems.
Right.
Yeah.
And how do you patent some of these things when they're natural?
Right.
You
You
can't.
can't. So you can't make money off of it. Right.
Or they can make a fake vitamin D though.
Right. Synthetic form. Yeah.
Synthetic form, right. And then they can prescribe that and they'll tell you, oh, you need to take the prescription fish oil that's chemically made. Here, your pharmacy policy will pay for it. Don't do it.
Don't do
Don't
it.
do it. If it's not natural. Oh, here, take the retinol palmitate form of vitamin A. It's chemical, but but over 15,000 IUs is toxic.
Mm.
But if you take too much beta carotene, you turn orange.
And that's all.
That's it.
That's it.
Yeah, I remember feeding my babies growing up, fed them sweet potatoes till they turned orange. Is your baby jaundice? No, they're sweet potatoes.
You are what you eat.
Yeah.
Literally.
And if you got lung issues, sweet potatoes, vitamin A, carrot juice, vitamin A, beta carotene. They've got the fake vitamin B12 called cyanocobalamin, the cheap form that's in everything. Oh, this vitamin's got vitamin B in it. It's got to be good.
No.
What's the best form? Methylcobalamin, the active form.
Right.
Cyana. Like cyanide? Cyanide.
Like cyanide, yes, cyanocobalamin.
Right.
That's where they take cobalt, cyanide, and cobalamin, put it together, and the shelf life is great. But you take methyl groups in cobalamin, cobalt, put it together, the shelf life's not so great. But your liver uses methyls to make your B12 work. Your liver uses methyls to chelate metals. Your liver uses methyls to drive your body, to make it work. And if you are low on methyls because you have too many heavy metals in your body, you're going to be low on B12.
Right.
And if you take cyanocobalamin, your liver says, I gotta get rid of that cyanide. So it strips the cyanide off with methyls, and then it has to take more methyls to stick back to the cobalt to make methylcobalamin. And so the first 2 or 3 times you get that vitamin B12 shot, you're going like, yeah.
And I really think it's a lack of awareness because I have ordered both cyanocobalamin and methylcobalamin. Not a lot of price difference. So if people are more aware, maybe they will do the right thing. Especially or when you buy the supplements on Amazon, some of them will say cyanocobalamin, some will say methylcobalamin.
Right.
But it's not like one is like 10 times more expensive than other. As long as you have the knowledge, you have to get the right thing.
Yes. Right. And our good things are not cheap.
Right.
And what's the opposite?
Yeah,
Cheap things are not
not good.
always good.
Mm-hmm.
If good things are not always cheap, cheap things are not always good. So you get that vitamin B12 cyanocobalamin shot, you feel good. You know, I want to go get another one next week. Yeah, good. 3 or 4 shots later, you go like, didn't do so much for me this time. And then pretty soon they give you the shot, you go like, I feel worse
Mm-hmm.
because you're depleting your methyls
Right.
in your liver. You're poisoning yourself.
Yes. Yeah. So when you're going in to a nutritionist office or a doctor's office to get your B12 shot, you have the right to know and to ask,
Yes.
you know, what form of vitamin B are you using?
Have them bring you the vial they use.
There you go.
Yeah.
And if they are honest and have nothing to hide, then why can't they show
And
you?
here's something else. If you're going to get a vaccine, I'm not anti-vax. I'm not anti-vaccine,
I'm
but
anti-vax.
you get that. You get the insert out of that vaccine and you read it before you inject that in your child's body.
Yes.
And you look at all those ingredients and you ask your doctors, is this good? Is this good? Is this good? What's this going to do to me? What's the side effect of this? Isn't this carcinogenic? You know, why are they putting aspartame in my vaccine?
Right. So I need clarification. Why are you not anti-vax?
I'm anti what they put in the vaccines.
Got it.
And I'm anti how many vaccines they give. Because it's 72 vaccines between birth and 18 years of age now.
Ridiculous.
72. I blogged a few days ago on Facebook. When I was born in 1960, there was 5.
Mm-hmm. Yeah.
72 vaccines.
Hmm.
Chickenpox, is that going to kill you?
No.
No. It's not. Chickenpox vaccine, does it kill people?
Yep.
It does. It does. Does
And
it
these
injure
have been
people?
recorded by the CDC
Yes.
themselves.
On the VAERS.
Right. And their motto is, well, the benefits outweigh the risks.
Yeah.
And I always say, tell that to the parent that lost their child, you know,
Yeah.
after the MMR vaccine or whatever. You know, it's just such a fine line. But obviously, we're not judging any parents that choose to vaccinate because they are doing what they feel is best for their child, and everyone has their own rights to do that.
Yeah.
So we're not going to ever bash
But
anyone
spread
for
them
that.
out.
Spread them out,
What
or don't
child
do it at
gets-
all. I don't know.
What child gets mumps, measles, and rubella the same day naturally?
Never.
Never. And that only uses, if you get mumps, that uses about 3% of your immune system resources.
Mm-hmm.
If you get the MMR vaccine and you don't go into a cytokine storm, it uses over 70% of your available immune system
Mm-hmm.
resources right then. So get them one at a time.
Yep.
Spread them out. A child, when they're hours old, they give them a Hep B shot. Now, how are they going to get hepatitis B? Are you going to share your used drug needles with them?
Right.
Come on, people. Don't share your used drug needles with your infant.
Mm-hmm.
All right. Are they at risk of being sexually molested by someone who has? Hopefully not. But that's how it's transmitted, right?
Mm-hmm.
So they had this 20-year experiment back in the 80s to see if they could curb the population, the HIV, the hepatitis B occurrence in the adult population by giving the newborn a Hep B shot. And 20 years passed, didn't work because they had to have boosters, and it still didn't work with the boosters. But guess what they still give the infant? Hep B shot. So, and that's a whole nother lecture.
Mhm.
Oh boy.
Okay, back
Spread
to what
them
we
out.
can do for the thyroid.
Put them off, spread them out. Put them off, spread them out.
Right.
Put them off, spread them out. Oh, but the doctor's throwing a fit. You're behind. Now you're 7 behind. We're going to give you 7 in one day. I've had nurses tell me I had to give 7 vaccines in one day because that child was behind. Oh my gosh.
Right. So with the astragalus, what we can do
Astragalus,
for the
okay.
thyroid.
Come back.
So I know, Dr. Nishu, you had mentioned before when I was here in your office that there are certain patients that you would not give astragalus to.
Right, absolutely. So, my main focus when it comes to thyroid is autoimmune thyroid condition like Hashimoto's Graves. So when there is an autoimmune component to it, I treat the disease like it's an immune disorder and not a thyroid or endocrine disorder. And I look at the different branches of the your immune system, your Th1, Th2 pathways. There are different pathways. If they are imbalanced, that's when your immune system becomes overactive. You make antibodies. Astragalus will help correct certain pathways, but not others. And I can't do the testing for the pathways because insurance companies will never cover them. My patients end up getting a bill. So instead of using nutrients that target each pathway, I use nutrients that help support the entire immune system or the T regulatory cells. Because without testing, I just give them nutrient support for each pathway. It's dangerous. I might make them even more imbalanced. So that's my thought on astragalus. However, I use that all the time. It's an amazing herb. I use that for patients with adrenal issues, with kidney issues, and it works really well. But when it comes to Hashimoto's, I try to support their entire immune system using things like vitamin D, glutathione, and omega-3 instead of astragalus.
Got it.
Yeah.
Okay.
But now astragalus is an adaptogenic herb.
Yes.
So if you're high, it brings you down. If you're low, it brings you up. All right, so it's pretty safe, and I have not heard that argument, so
Right.
I like it, and I think you should listen to
But
this.
rare occasions, but in
Yeah.
general, astragalus is safe, and I use it all the time.
Okay, another good one is ashwagandha.
Right.
Right? How much do you like ashwagandha?
I love it. I have bottles and bottles of tinctures in the front with just ashwagandha in them.
So you might want to check our bags too before we leave.
Right?
Oh boy, yeah, ashwagandha, shisandra.
Shisandra,
That's a good one, and the tinctures tend to assimilate quicker, better, especially if you use them sublingual. The buccal mucosa, the lining of the mouth is like you can put vitamin B under your tongue. It's in your blood in 30 seconds or less.
Yes.
Right?
Yep,
If you
so
take the vitamin B capsule, it's 2 hours later still trying to distribute.
Yes, exactly. So sublingual just means under the tongue.
Right.
So just, yeah.
Yeah. So let's see, full spectrum vitamin Bs. Here's the thing about full spectrum, your vitamin E. If you take a lot of vitamin E, and it's almost, what's the gamma? Is that the one?
Yep.
The gamma E. Well, it's a spectrum vitamin. Your body needs the alpha, the delta, the gamma. It needs all of those. If you're just taking one, the gamma, in order to use it, it pulls all the other alphas and deltas and puts it together. And all of a sudden, you're shorting your whole vitamin E. You need to take the full spectrum vitamin E, the full spectrum vitamin B. Or you could actually be shorting your body thinking you're taking the B vitamin you need, but it needs all the other B vitamins to make it work. So let's see. Viva la Thyroid is without a proper
So
adrenal
armor.
function.
What about these ones? Armor thyroid, nature
That's some of
thyroid.
the natural thyroid, their prescription, because heaven forbid they let something go by natural, they can make $1 billion on. And I don't recommend self-medicating in these cases. You really should be monitoring. So, but the old folks, you know what they used to do? They would eat the thyroid of the cow.
Oh.
And they called it sweet bread. It was the sweet bread of the
Wow, I
cow.
didn't know that.
And they would make their own thyroid. And the old folks, when they were getting cold in the winter, they would need some sweet bread. Isn't that
Wow,
interesting?
that's really interesting.
So now
Was
it's
it
a
a brown
prescription.
cow or a black and white cow?
Ooh, let's try brown cows if we can.
Right?
Another lecture. Without a proper adrenal function, thyroid hormones cannot be utilized by the body. Remember, we had that thyroid's level, the adrenals are level, the thyroid goes down, adrenals come up, gets back, and then if this breaks and this goes way up,
Mm-hmm.
right? And then when this breaks, you're running on cortisol to keep you alive.
Mm-hmm.
So without properly functioning adrenals. So it's not only about the thyroid, it's also about the adrenals. That's why on this basal temperature chart, let's see, is the temperature jumping up and down, right? And you can have this one when you leave.
Yeah. Question. I don't know if it's related to thyroid. Sorry.
Question.
The MTHFR gene, is that related to thyroid?
I didn't hear the question.
MTHFR, she's wondering
Oh,
about. Is that
right,
related to thyroid?
Wow, that can be, that has to do with your ability to methylate a lot. And
That got to do with thyroid.
So she's talking about the MTHFR gene.
yeah,
And if you're tested and you have that gene defect, then she's asking, is that or could it be related to thyroid dysfunction?
well, if it's a genetic defect, it's a broken gene in your body. You can't fix it. You can only support it. Right? As far as I know, I mean, there's a reason it's broken.
Is there a test for that?
There are tests, yes.
There's a test, and I notice a lot of my patients who have a lot of food sensitivities, who have autism, ADHD. A lot of times they have that defect, and you have to be careful to choose what supplements to give them. For example, folate. Someone with that gene defect, if you just give them regular folate, that could be building up their body, becoming toxic. You have to give them the right nutrients. And without those essential nutrients like a methylated form, B12, folate, I do believe that everything's connected. So I do think, to a certain extent, it does affect your thyroid health.
Yeah.
So let's back up just a minute on that methylfolate. Never, ever, 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 ever take folic acid. It's the chemical version, and it can actually, I think it's 16% of the population, they take folic acid. It shorts their folate. It makes them more deficient than before. But the methylfolate you're talking about is activated form. You need methyl groups. The MTHFR is a broken gene where you can't methylate properly. You can't build your methyl groups and hold them together right. So you need to support that methylation process.
Yeah, and without methylation, you're increasing the toxic load for your body. So it's important to identify whether you have that or not. And a lot of doctors' offices can run that test for you. And after that, you can ask them, based on my result, what do you recommend that I supplement myself on a daily basis?
And then Facebook us.
Right. Ask us, is this right? Or just come Dr. Nishu. Because if you think about it, most doctors are just going to do A, B, C, D for every single patient. But Dr. Nishu looks at you as an individual, which you are. We are all different and we all need to be treated differently. And if you haven't noticed throughout the conversation, that's exactly what we're talking about, is treating our patients as individuals and giving supplements that are individual to that person's needs.
Yeah, every time I have a new patient intake, first of all, I spend 2 hours just talking to them without typing or being in front of the screen to get their life story. And then I have them come back in 2 days for their blood draw. And that's 2 days I sit down and think about what labs do they need. It's never the pre-made panel for everyone.
You don't have a cookie cutter?
Oh, no. I have a cookie cutter at home.
Well, wouldn't it be neat, though, if we had cookie cutter medicine that actually worked?
For everyone.
If it worked, then sure. Yeah, if there was a pill that fixed everything, of course. But
there are some cookie cutter pills that are good. I recommend taking methylcobalamin.
That is.
Yeah.
Right. Absolutely. I recommend taking a good high quality fish oil.
Absolutely.
Oh my gosh, yes.
Right. Probiotics.
Probiotics is for everyone.
Vitamin D.
You can't go wrong there.
But here's the other thing. If you're deficient in a deficiency, you need to supplement, right? Well, why do you need to supplement? Because you have a deficiency. Why do you have a deficiency? Probably diet. So if you have let's say your income was a little low, you need to supplement your income, right? Well, what's the real problem? Your income's low.
You're not making enough. Yeah.
Fix that. Then you don't need the supplement. If you are relying on supplements through the decades following, it's because you haven't taken care of the cause.
Right.
You've not taken care of your digestion, your thyroid, your diet, the basic things. We
Yeah.
should be learning this.
We
Right.
do like supplements, but we don't believe that supplements are more important than proper diet.
Right. And also that you shouldn't have to take them for the rest of your life.
Right.
If we're legitimately fixing something, you know, like I've seen weight loss clinics give supplements and they expect the patient to take it forever. And that's just not
Well,
That's
logical.
just to
On
make
auto
money.
ship.
Yeah.
Right,
Put it
on
on
auto
auto
ship,
ship.
yeah. So you're making money for them, and that's really what it's all about. They don't care genuinely about the patient. But also, I wanted to touch on that because with Hashimoto's,
Mhm.
you have. So if anyone's ever heard of the AIP diet, which is the autoimmune protocol,
Mhm.
which a lot of people with thyroid disorders have been placed on by their nutritionist or their doctor. And it's basically a diet where they eliminate so many foods. So you're only allowed a small portion or a small amount of different foods to eat for 30 days. And then after that 30 days, they add back each individual food to kind of test your body and see how you feel, to determine if that food is what the culprit is. And then furthermore, in your future, you would be avoiding that specific item. So with Dr. YiQiu, however, it's different. You don't have to go through that because a lot of times, like he mentioned earlier, it's hard for the patients to follow such a strict elimination diet. And so
And take care of children and take care
Thank
of
you.
Exactly.
Life, right? We
Yeah.
all have busy lives. And so what he does is he does a simple blood test. We do a simple
Mhm.
blood test that allows us to find out what foods are triggering these thyroid dysfunctions, these autoimmune dysfunctions, so that we can hone in on those specific foods and eliminate those individually instead of the whole AIP. So we do incorporate some of the AIP, which is no sugar, gluten, or dairy.
Right. Whether it comes up
Mhm.
under panel or not.
Right.
Yeah.
Thank you. Yes. But what comes up on the panel is specifically what remove instead of making you go through
Yeah.
torture, pretty
Yeah.
much.
Right,
So,
yeah, because if you're allergic to shrimp and you eat shrimp, what happens? Oh, you get the epi shot, right?
yeah.
That happens now. What if you're just intolerant of shrimp? And 72 hours later, I'm not feeling so good, but
Right. Absolutely. It's a delayed reaction. It's how your immune system responds to the food that you eat. And food intolerance gets a bad name. Sometimes it's controversial. And that's because we're not properly educating the public. Other doctors saying that it's a controversial test because they are thinking, oh, we're just trying to make some money by running the lab and sell it as food allergy, but it's not. Food allergy and food sensitivity are very different things. You are not allergic to these foods. They're just causing an immune reaction. While we're healing your gut, while we're giving your immune system a break, avoid those foods, not forever, just for a little while. And that's a difference between food allergy and food intolerance or sensitivity.
Precisely.
very good.
Thank you.
Cool. Well, let's move forward with something I want to talk about. Hormone disruptors.
Big
Gosh,
Hormone
so
disruptors.
many.
Boy.
So many.
Did you know that when you go to CVS and you get this receipt that's that long, you know what's in it? BPA, bisphenol A, which is a plasticizer, which is a hormone disruptor, which is a feminizing agent, which is it kills your thyroid. It makes your sex hormones go feminine, basically, too feminine, causes estrogen-driven cancers. So that's one. Receipts have it.
Oh my god, I don't want to
What-
see it.
Right. No
I
thanks.
know.
Send the
They always
receipts to my email.
They want to hand them to my kids. I'm like, no.
Right.
And
Yeah.
they look at me weird.
Hey, do you want your receipt? No.
No thanks.
At
Put
least,
it in an envelope.
yeah, at least Sprouts up in our end with the woods. I was like, do you want a receipt today? No. Save the tree.
Wow.
Send it to my email.
Hey, Craig, does that, so every time we go to the dentist for my kids, she's always pushing, put the coating,
Sealant.
that coating, that sealant.
That's a
And I feel like such a bad mom because she's like, you're going to protect them from cavities. And I'm like, but I don't
No.
think that's good.
okay. Well, let's chase another rabbit trail. The teeth are living bone, right? Bones heal themselves. Did you know that if you have a cavity today and you change your diet and you maybe switch some coconut oil with some clove oil with some, some good stuff in it every day, did you know that that tooth will regenerate?
I know
Yeah. And it's living, breathing bone. And the glycerin in toothpaste puts a coating on that stifles the tooth and causes more tooth decay than it will prevent. And these sealants seal, ooh, good stuff. A little baking soda once in a while. You know, some bentonite clay. They've got Redmond clay products that are excellent.
Mm-hmm.
And
Baking
the
soda
kids
and
love it.
peroxide. Yeah, the kids love it.
Yeah, a little
Yeah.
bit of peroxide, not a whole bunch of peroxide. You know, back to the Epstein-Barr virus. It functions in low oxygen. Hydrogen peroxide is H2O2. Right. So 5 drops of food grade in your water, drink it. Helps bring your oxygen levels up.
Be
in your
careful.
body. Helps.
Yeah, be careful with it.
Okay.
You have to dilute it, like you said. I want to
Oh,
make
right.
sure. If you don't dilute it, it's gonna
if it's
hurt you.
the 12%, yeah, dilute it. Yeah, don't take it direct.
Right.
I think most of it's 12%.
Yeah.
Just 5 drops in a drink glass of water a day will raise your oxygen level up. Fight viruses like Epstein-Barr.
Right.
H2O2, right?
Mm-hmm.
So what is H3? What is that? I mean, O3. Ozone.
Mm-hmm.
Ozone.
Yep.
Ozone is awesome. It fights
You do
cancer.
those.
I don't.
No?
Not
Oh.
yet.
Ozone
Big
fights
question.
viruses. Yeah, we had one at the last clinic I was in.
Yep.
And you can take this big old syringe and mainline it, and you're pushing gas in, and you go like, wow, is that going to embolize?
Right.
No, it doesn't.
No, it doesn't. Mm-mm.
And you push it in until it comes out the lungs.
Mm-hmm.
The patient goes, and you smell ozone. You go, okay, they're full.
Yep.
And it fights cancer from the inside. It's oxygen. Cancer cannot survive. Most of it is survives in low or no oxygen.
Right.
So you give it oxygen.
Right.
Right, and H2O2, and you brush your teeth with just a little bit. You know, maybe clean your brush with it, brush your teeth, gets rid of the pyorrhea.
Mm-hmm.
I've had people, I had a lady had green teeth, and the gums were infected and bloody and raw, and she said they were going to pull all their teeth and all this, and I said, well, dip your toothbrush in hydrogen peroxide, start brushing with that 3 times a day. 3 weeks later, their gums are coming back. Her teeth were looking better. A few months later, she had healthy teeth.
Wow.
So didn't sell this whole denture work thing. And hydrogen peroxide is cheap. I buy the gallon of the food stuff, the food grade,
Amazon.
on Amazon.
Mm-hmm.
A gallon.
I have a big one, $20, like $20.
Yeah, and you know why I buy the big one? So I can give it away.
Mm-hmm. Yeah, because you're not going to use all that. Neither
You're
am
not gonna
I.
use that. So we got endocrine disruptors. Toothpastes have
Mhm.
fluoride. That is an endocrine disruptor. Okay, so iodine, right? That's what we call in the periodical chart. It is a halide, right? So is chlorine, fluorine, and bromine,
Mhm.
right? So they're very similar to iodine, right? Molecularly similar. So bromine we get in our breads.
Mhm.
They put it in bread because it makes it fluff up and makes it stay fresh longer. They used to use iodine in bread to help make it fluff up. They did. Now they use bromine because it works a little better. Chlorine, where do you get chlorine?
Mhm.
Public pool.
Right, the pool.
The pool and your water.
Shower. Yeah, your
hot
It's a
water.
disinfectant. It's everywhere.
Yeah.
Right, chlorine. And then the other one is fluorine.
Mhm.
Fluoride.
Yeah.
Fluoride tooth treatments, never. Do you know the kidneys consume the most fluoride trying to get rid of it? The second organ, it's kind of an organ, the second biggest consumer of fluoride, if you've got fluoride and that's not a good thing, is the pituitary gland.
Mhm.
So the pituitary gland tells the thyroid to work. But let's take these halides. They're the same shaped key. Like now we have our keys in our pockets, but I've got a 66 Ford pickup truck I'm working on right now. Call it the Beast.
Yeah.
And she's like, yeah, I
It
hit
is
that
the
thing with my
beast.
Cadillac and it hurt my Cadillac.
Yeah.
But anyway, it's got a Ford key. And it looks just like all the other Ford keys from that era. But you stick another Ford key in, it won't turn the key. Iodine works in the cellular pathway and in the nucleus of the cell. Fluoride doesn't. It's stuck, and then it just stays there. Now you can't get the iodine key in there. Chlorine gets stuck.
And the car will never turn on.
Right.
It'll never
Just like
turn
your
on. There it
thyroid.
is.
Yeah.
Mhm.
Bam. Thank you.
Mhm.
So when you start taking extra iodine, it starts to push that fluorine, chlorine, and bromine out of the pathway, and then your body goes like, oh my gosh, now I got to deal with this. So it can actually cause a toxic reaction. But that's one of the reasons why I recommend such a high dose of iodine. Right? I say if you're behind, if you got cancer, I've started some people on 100 milligrams a day, 200 milligrams a day. There's a book, not my book. It's called Breast Cancer and Iodine.
Mhm.
And this guy gives 200 milligrams. That's a lot.
That is.
And I'll tell you what, if you need it, your body's going to use it, and there's not going to be a side effect.
Right.
If you don't need it, you're going to start going like jitters, and your body temperature is going to come up, and you're going to have trouble sleeping. You're going to wake up in the middle of the night. Your heart's going to palpitate
From too much iodine.
from
Yeah.
too much. In that case, cut back.
What's the best way to take it? I remember you talked about like painting your skin with it,
Well,
or
the
is that
patch
just a
test,
test?
painting your skin tells you how much you need. Right? So you get the orange iodine, paint your skin, it should last 24 hours.
Okay.
And I've had ladies with breast cancer, I say, okay, go home, get you a bottle of povidone iodine from Walmart, right next to the H2O tube,
Mhm.
and put it in a jar with a little foam paintbrush, paint your boobies. And I've had them call me and say, but this stuff's supposed to stain, and it's not staining.
Instantly, it's absorbed. Yeah.
Ah.
They were deficient.
Right, I had a girl with stage 4 inflammatory breast disease, and this one breast was like twice its size. It was probably 107 degrees temperature and flaming red. And she was scheduled for a mastectomy Monday, and this was like Thursday. And I said, oh, I'll go to Walmart, get it, and by Monday the swelling was going down. A week later, she almost had a completely normal breast. 2 or 3 weeks later, she's going like, they're going to chop my boobie off. I'm mad.
Mm-hmm.
She was so iodine deficient, and the breast, female breast consumes the most iodine in the body. Ovaries are next. The testicles and the prostate for the male.
So what's the best way to take iodine? Just paint it, or
Well, you can paint it, but
drops? Or...
if it disappears within 24 hours, you're deficient. You know, if it's just barely yellow in 6 hours,
But would
you're
you
deficient.
recommend like a
Supplement.
capsule or?
Capsules.
So,
Okay, that's
the
because
Terry
I've seen the
Natural,
drops. I've seen drops of it,
Right.
and I've seen capsules.
right? The Terry Natural is good, but I also recommend supersaturated potassium iodine. It's called SSKI.
Mhm.
Kind of expensive on Amazon, but if you get the scientific potassium iodide, which is KI, SS stands for supersaturated. SSKI, you take the KI and you mix it with water till it won't absorb any more potassium iodide. Then it's supersaturated. And then 1 drop of that, 1 drop is about 50 milligrams. 50 milligrams
That's a lot.
of iodine.
Wow.
And if you've got a cold sore, you put a drop of that on, it's going to burn. It's not going to scald you, it's going to burn. And that cold sore is going to go away. I've had people with skin cancers. You just put a drop on there, maybe mix it with a little carrier oil, so to speak, to help it spread out a little, you know, and stay around longer. And their skin cancers go away.
Wow, that's amazing.
It's worth a try.
Mhm.
So we have endocrine disruptors, iodine is what you need, chlorine, fluorine, bromine are what you don't need. Phthalates, PHTH, LATA, something like that. Phthalates, they're plasticizers. Have you ever smelled that shower curtain that you get out of the package? Don't do that. Don't smell that. In fact, if you're going to buy a new shower curtain and you can't get one that's phthalate free, you better wash it first to help get the extra off. But that is a feminizing, phthalate is a feminizing endocrine disruptor, plasticizer. It makes plastic soft. Right? And that's what it's for. Because plastics are hard and brittle. Phew. And these are gender benders. Gender benders. So, another gender bender, a feminizing. We're talking about feminizers now. Soy. So the baby, they quit breastfeeding babies years ago. When my babies were born, her parents absolutely told us we couldn't breastfeed. That's nasty. You don't want to do that. And I'm like, by golly, we're going to. Well, don't do that in our house. Okay, then we'll come to your house. Soy, that's what you give them. Soy formulas, soy-based formulas, estrogenizers. And now the little girls are popping out with breasts at 7 years old, and the little boys are all confused about their gender, and then we get estrogen-driven cancers, and we do it to ourselves because of these plasticizers, the stuff, the crap on the receipts, the stuff in our food, the soy. Guys don't ever do soy. Get rid of it. Guys don't do soy. Now, fermented soy is totally different. That is excellent. Fermented soy. But soy is that, you know why they started growing soy? To make plastic out of it. Back in the 1920s. And then the Soy Association was looking how to market it. Well, it's some pretty good protein. Not, because it carries phytoestrogens with it.
Right.
Guys do not need phytoestrogens. Girls do not need phytoestrogens. However, with that said, I've had girls who are high progesterone, and they drink one cup of soy milk, organic soy milk a day, and it brings them right in balance. So it's kind of a two-edged sword, but soy, everywhere soy. Edamame. Don't do edamame. Please don't do it. But I love edamame. Well, don't do it. Then the other thing I want to talk about is radioactive fallout. So what happened in, what was that across the pond in Japan? Fukushima. Right, meltdown. And that radioactive iodine is lofting especially over the Northwest, and it's showing up in cow's milk, which means it's getting in people, it's settling on people. And your thyroid needs iodine. If you are deficient in iodine and it's falling out of the air, getting on your skin, your thyroid's going to take it in. Just like it does the Peyton iodine, like we were talking about. Right? It will get there. Your body will take it in, take it to the thyroid. Right? So you want to be iodine sufficient.
Right.
In this day and time, because of all the radioactive things. If you're walking through the airport, you're getting ionized radiation. If you're crossing a border, international border, they have meters to see if you have radioactive waste.
Wow.
You're getting a dose of radioactive ionization. If you ride on a submarine, you're going to get radioactive stuff. And if you're deficient, it's going to go straight to your thyroid. It's going to cause problems, including autoimmune diseases, because radioactive is not good for you. And it's going to short your glutathione. This guy's big in glutathione. I'm like, yeah, I came here today for a glutathione push. I got roped into a lecture.
That was my plan.
Well, now I'm going to take some glutathione intravenously before I leave, because it's awesome. It helps you detox and helps your thyroid work.
Exactly.
Just good stuff.
We'll all take it.
Oh,
Yeah.
good.
So line up, everybody, for your
Right,
glutathione
line
push.
up.
I hope you got enough.
No, I do.
Good. I have a quick question.
Okay.
So I have a client specifically who asked about water. What type of water should I drink? There's so many different bottled waters and purified water and distilled water, and I don't want to have chlorine and fluoride and all this stuff in my water. What do I do?
That's a big problem, because we need clean food, clean water. If we're going to be healthy humans, we should be eating healthy food. And when you go eat a sick cow, you're going to get the sickness of the cow, the diabetic cows in our meat counters that are full of antibiotics and everything else, keep them alive long enough to get them to market. And fed grains, which cause inflammation, which causes diabetes, which we eat. Okay, so healthy water, healthy food to be a healthy human. And water, we need spring water. It's got to have lots of good minerals. But who's got a spring? Anybody here?
In Arizona.
Right,
Nobody
not
here?
Arizona. Yeah.
Oh yeah, this is Arizona too.
Mhm.
Wow. So, get spring water. But it's packed in plastic, and that's got plasticizers.
Mhm.
One of the biggest things is don't let it get hot. If you set your water bottle in your car and it gets above 100 degrees, those plastics leach into the water.
Right.
Yep.
But I highly recommend spring water, bottled spring water. There's this big thing about alkaline water. Right now, you need to alkalize in the evening. You need to be acidic in the morning. So drink your alkalized water in the afternoon. But RO filtering is good.
Right. I tell my patients, get a reverse osmosis
Yes.
system, make your own water, and then, I have them sometimes put a couple of drops of trace mineral drops in there,
Yes.
and then put in like a glass jar and take to work.
Yes.
Glass.
Yeah, glass jar. Did you hear that? Glass. A glass container, a stainless steel container, as long as it doesn't get hot.
Right.
Right. And if you put acidic fruits in a stainless steel, it's going to leach the metals.
Yeah, don't do
Acids
it.
leach
Yeah.
metals.
Right.
So reverse osmosis, but you know what it doesn't get rid of? It doesn't get rid of fluoride.
Right.
Good to know.
That's good to know. The only thing that gets rid of fluoride is bone char. And that's why I had your husband putting in a bone char system
Mhm.
at a friend of ours' house a few weeks ago.
Mhm.
When we lived in Queen Creek, Arizona, I had bone char, a carbon filter, and then a bone char. Carbon gets the chlorine out.
Mhm.
Bone char gets the fluorine out.
Okay.
Right.
Right. And then we also had RO in our kitchen, reverse osmosis. And then I put trace minerals in the water.
Right,
to
which
drink.
is perfect. Yeah.
Right.
Yeah, we also own a plumbing company, Plastic
by the
Guys
way.
Plumbing. So if you need one of those installed, you can call us as well.
Right. And they're self-flushing, they're back flush.
Mhm.
So they're really low maintenance. They get rid of the chlorine and the big particulates and the drugs. Because now we got drugs. Somebody here was telling me the other day they threw their drugs down the toilet, and I'm going like,
Don't.
I gotta drink that next week.
Yeah, thanks.
Let me guess what condition you have. Right?
Yeah.
Right. Wow.
Boy. Yeah, take the medications to the pharmaceutical companies. Let them take it back to the pharmacy.
Yeah.
Don't flush it, please.
Right.
Because now our fish are coming up
Right.
with both organs, both sex organs,
Mhm.
or they're not able to reproduce, or they're coming up with cancers and weird stuff and growth problems, and we drink that water, and the fish can't survive in it. If you want to know if your water's any good, go to Walmart, buy a goldfish. They're 39 cents. Go home, pour up a glass of water, and put them in there. See if it can survive. It's mean. Don't do it, really. Don't do it.
Right, don't do
Because it's
it.
cruelty to fish.
Right.
Yeah.
But if your fish can't live in it, why do you want to drink it?
Right.
Right.
So, Craig, can I get clarification on the water? So, spring water, a lot of it does come in plastic. Are you saying?
I'm saying that's about your only option.
I mean, I know there's. What's the one in the green bottles? There's the spring water in the green bottles. It's quite expensive, but I mean, we've
Oh,
got
the
a lot of
Perrier?
kids.
Perrier?
Not Perrier's Mountain Valley.
Oh, it's a local thing.
I don't know.
Send them
Well,
a picture of it after.
If you get it in a glass bottle, fine, but
What about stuff like Pellegrino and Perrier and things that are in glass, but there's carbonated?
well, carbon knocks phosphorus out of your bones.
Right, yeah.
I don't recommend that. Right, so that carbonation, all right, it's okay occasionally, but are we doing okay there? All right, we're really running long, but I think we're having fun. And you guys on live, you can stop and start this.
Right.
And come back to it. And this will be archived, and it's on YouTube, my YouTube. It's on my Facebook. It's on your Facebook.
Mhm.
It's now on your Facebook.
Yes.
Welcome to Facebook Live.
Thank you.
Woo.
First
First
time.
ever.
First
Yeah,
time.
first time. Yay.
Yeah, and we should do more of this.
Absolutely.
But for the water, back to your question, it's a tough situation. When we were here, I would try to get the 5 gallons of RO water. You know, when I had an apartment before I had my own water system in my own home, and put my own minerals back into it. And you need lots of water. And if you have to buy little tiny jars of water from the store, it's expensive.
Mhm.
But if you can make your own at home, carry it with you. But you gotta have clean water. You gotta have clean, healthy food. And then if you've got problems, you've gotta find Dr. Hu. You gotta find nurse.
You can say that. I'm just kidding.
I don't
Naturopathic
mind.
nurse Nikki.
Right.
Right. The solutions are out there. If you don't have time, when are you going to?
And
Right.
whatever you need, go to Walmart or Amazon, right? It's like we're sponsored by them. Yeah, we get this from Walmart, that from Amazon.
Yeah.
So I also wanted to mention, because you were talking about the meat and the milk and whatnot. So I use Green Prairie Pastures. They're located here in Arizona. They do have grass-fed, grass-finished beef.
That's important.
No antibiotics, no hormones injected into the cows. They are brown cows. And they also, their milk is A2 milk, and so I use that milk for my kids. So I feel very blessed to have found them. So if I do have a lot of clients who are looking, because it's hard to find. It's hard to find milk from brown cows. It's hard to find meat from brown cows. So if you're looking, you can tell them that naturopathic nurse Nikki sent you to Green Pastures Creamery here in Arizona.
And if you're listening from anywhere else in the United States, get on Craigslist.
There you go.
Craigslist. Look for Jersey milk.
Yep.
And then
Jersey
when you
milk.
find the Jersey milk, say, have you tested your milk? Is it type A1 or is it type A2? Is that I'm saying it right? The A1.
Yes.
A1 has a caseomorphine protein in it. What? Caseomorphine, right? And some children are so allergic to milk, they get milk, they're gone. They're on morphine. So you do not want this caseomorphine in your body. So the Jersey milk, brown Swiss, the black and white cow, no. They are all type A1, that's bad.
Where does that fit into your recommendations of being dairy-free? As far as this raw, grass-fed, A2, brown cows, where does that fit in?
Right. So a lot of my patients who are, very sensitive to gluten and dairy, they travel to Europe and they can eat all those things, no problem. So, but I try to consider their lifestyle. If it's impossible for them to get, grass-fed, grass-finished meat or, the brown cow dairy, because not everyone can do that. And I tell them, hey, avoid those things for the next 6 to 8 weeks while you heal. And then, try to introduce them or not, or no, or you don't introduce them. So, however, if someone can get, the right type of milk, go for it. Yeah, have all you want.
Yeah, well, goat's milk. Good organic fed goat's milk. But here's the other thing, if they feed them soy, it causes inflammation in the goat. Now you got a sick goat. You drink sick goat milk, you're going to be sick. There was a guy here, he was retired. He was a Phoenix policeman who had goats. Of all things, he raised goats as a hobby to make soap. Love that guy. And he fed them organic. He fed them. When I met him, I said, I can't buy it. You feed them with soy. What's wrong with soy? And as soon as he fed them on soy, and that milk tasted awesome. When the first sample I had from him before I found out what he fed smelled like goats. You drank the milk, and it's like you just licked the goat. And when he cleaned up their diet, they tasted awesome. And that goat milk is awesome. And it's better for babies than cow's milk. It has a better balance of alkalinity and calcium. Goat's milk has cow's milk has something like 300 times more calcium than a baby needs because it's trying to grow a calf.
Right.
But regardless, I digress on that. Find a good brown cow.
So that goat milker is here in Arizona.
But he's retired. He's gone traveling. He's in Europe eating their wheat and drinking their milk right now.
Nice.
And he's on Facebook saying how great everything is over there.
Right.
So he's not here milking his goats. So I can't recommend him. And he only supplied, like a few families because it was a hobby. But there are people out there.
Right, and Glendale Farmers Market, I know there's a lady there who goes there every Saturday, and she sells, goat milk, goat cheese, and soap because she has a lot of goats in her house, and you can actually buy one from her, and she will raise it for you and give you the milk and the mixed soap for you. I've never been there, but one of my patients told me about that, so you can.
You've invested in her farm.
Exactly.
Right, you own the goat.
Yes.
Yep.
That's beautiful.
Right, dairy sharing. That's why you can get raw organic milk too. By dairy sharing. Well, I want to buy interest in your cow. Because if they pasteurize it, they kill all the good stuff.
Right.
They homogenize it, they make it so your body can't use it.
Right.
So I recommend organic raw milk.
Yep.
And keep it clean and you'll be fine.
Right.
If it smells bad, it is bad.
Yes. Yeah.
Well, what else, guys?
That's pretty much it.
Yeah, we've covered everything. I
Covered
think.
a lot
Yeah,
of
we
info.
did. We really did. Hopefully you were blessed by our lecture, and we want to thank you for joining us today. And just God bless you. We hope that you guys all have a great and blessed week. If you have any questions for us, feel free to reach out. Like we said, Craig is on Facebook, also at realhealthtalk.com. And Dr. Nishu is at medroyalaz.com.
That's right.
And you want to give your email address or contact information?
Oh, sure. Yeah, just all my contact information will be on our website. So whether you're from Arizona or not, feel free to give us a call. We have a lot of patients calling from out of state, and we're happy to help any way we can.
Right.
Yeah.
Absolutely. And I'm also on Facebook, Naturopathic Nurse Nikki. Trying to steal this show, huh? No, I'm just kidding. Naturopathic Nurse Nikki. So if you have any questions, find me on Facebook and send me a message as well.
And I write about a lot of what we're talking about in book 2, Fixing the Brain book 2. And book 3 will be out in a few weeks. So God bless you guys.
Can't wait.
We all thank you.
Thank you.
Okay.
Thank you. Bye.
Bye.
God bless you.
Shut all the cameras off.
So book 3
This
is
one's still
gonna be
going
coming
there.
out.
With that,
Book 3 is going to be coming out soon.
in
You've
a
been
few
working
weeks.
hard.
Well,
Goodness.
everybody, thank you for joining us
You did
today.
fantastic.
Naturopathic Nurse
That was
Nikki,
amazing.
here with
There's
Craig
you guys
Stelflug,
like
to my
so much
right.
information. I have to go back and take better
Read
notes.
it,
Thank
take
you.
notes. Yeah, good. We're so glad you're here.
Sorry, I
you.
asked so many questions. I was like,
Don't be sorry, it was
Oh, that's
fantastic.
fine.
You contributed. Thank you
Yeah, I'll
both.
just post it.
It was so nice to meet you.
So then I put it on your video.
Perfect. I'll just post that. Thank you.
Oh, Toby, that bottle. I forgot to talk about
Can I have a look
DHA.
at your books too?
Sure.
Here's this bottle and then books. Yeah.
It's called Very Natural.
Uh-huh.
Yeah, you needed those books 10 years ago.
Huh?
You needed those books 10 years ago. So,
10
sorry.
years ago?
With your boys, the book
Oh,
1.
the boys, yeah.
Yeah, I had your boys in mind when I wrote book 1.
Oh, there was a bunch of comments.
Oh,
I'll read them later.
okay, yeah. You probably have
Which,
questions.
can I get this at Sprouts?
No.
Awesome. Good.
Yeah.
I will.
Where can I get this?
I want to take a picture.
So I ordered it on Amazon.
I'm gonna take a picture of that really quick.